A coordinated public health response is already underway. While the risk to the general public is low, the Virginia Department of Health is working with the Centers for Disease Control and Prevention, the Fairfax Health District, the Prince William Health District, and our Department of Defense partners to identify people who had contact with the cases and may be at risk of becoming infected with this novel coronavirus. I would like to emphasize that protecting the health and well-being of Virginians is our top priority. The virus is spreading much like a novel influenza virus would. VDH, the Department of Health, has led a very robust and comprehensive pandemic influenza preparedness effort since 2004. VDH successfully responded to the H1N1 flu pandemic in 2009 to 2010, and that work serves as a very solid foundation for the work that we're doing in response to COVID-19. The Virginia Department of Health works with partners across all sectors, including healthcare providers, state and local government, first responders, and many community partners to prepare for and respond to outbreaks and all types of emergencies. For more details on this COVID-19 disease and our response to it, I'd now like to turn it over to our state epidemiologist, Dr. Lillian Peek.
Good afternoon, everyone. Testing for the patient at Fort Belvoir was conducted at Walter Reed National Military Medical Center. Testing for the patient from Fairfax City was conducted at the Department of General Services Division of Consolidated Laboratory Services in Richmond, Virginia. Both tests will be confirmed at the Centers for Disease Control and Prevention. Both cases had traveled internationally days before developing symptoms, and the two cases are not related. At this point, there are no signs of the virus spreading in the community in Virginia. As of 9 o'clock this morning, 44 Virginians have been tested for the novel coronavirus. 36 tests were negative, and we are awaiting results on 6 tests. Virginia has been preparing for the possibility of cases occurring in the Commonwealth since early January, when the novel coronavirus was first identified in China. The Virginia Department of Health has been closely coordinating with clinicians, our state lab, and other key partners statewide, so we are able to identify cases early and take action quickly to prevent the spread of the disease to others. Virginia's local health departments across the state are working with their communities to prepare, increase awareness, and encourage prevention. VDH stood up a COVID-19 webpage very early in the response, and we are keeping it up to date with accurate information. A call center is open for people who have questions about COVID-19. The number is 1-877-ASK-VDH3. If someone has respiratory symptoms like fever, cough, and difficulty breathing and traveled to an area where the virus is spreading or had contact with a confirmed case, please call your doctor to discuss your symptoms. Dr. Allison Ansher, the District Health Director for Prince William Health District, will now provide information about the case in that district.
Good afternoon. I'm Dr. Ansher. I'm the Health Director for the Prince William Health District, which includes Prince William County, Manassas City, and Manassas Park. As the others have mentioned, there have been 2 presumptive positive cases of COVID-19. The Prince William Health District is coordinating its response with the Virginia Department of Health, Governor Northam's administration, and the Centers of Disease Control. The Virginia Department of Health and the Prince William Health District are supporting the public health entities of the Department of Defense. We are working on the contact investigation in our district for those who are not on Marine Base Corps Quantico, and we will be coordinating with the other jurisdictions which may have some contacts to that case. Most importantly, we have exercised previously with Marine Base Corps Quantico in the past for various public health events, in particular for H1N1 response. So we feel that we have a nice coordinated relationship with the Marine Corps base and are prepared to help them respond. We are working around the clock, as you can see from the bags under my eyes, as the public health issue continues to develop and we learn more. The Prince William Health District is working on taking all measures, of course, to protect the health of the residents of not only our community, but of the state of Virginia. Finally, despite these two major developments, there are two action steps Virginia can do during this time. Taking simple precautionary measures to prevent the spread of this virus through their community and relying on the VDH and CDC website for the most accurate information. Next is Dr. Gloria Adiensu. She's the Fairfax County Health Director, and she will provide information on what's happening in Fairfax right now.
Thank you, Dr. Ansher. Good afternoon. I'm Gloria Adewayensu, Director of Health for Fairfax County. The Fairfax Health Department serves the Fairfax Health District, which is comprised of Fairfax County and the cities of Fairfax and Falls Church. As Dr. Oliver stated earlier, a Fairfax Health District resident has tested positive for COVID-19 through testing conducted at Virginia's Public Health Lab, DCLS. Again, this is a presumptive positive result, which means that the CDC will be confirming the test results. The individual is a Fairfax City resident. And while we await confirmation of the test result, we are taking public health actions and are working closely with our city, county, and state partners to monitor the patient and identify any close contacts who may have been exposed and would require testing or monitoring for symptoms of COVID-14. Fortunately, the individual had limited contact with others while ill, and therefore the risk to the general Fairfax community remains low. Next, Dr. Ben Schwartz, who is a medical epidemiologist and Director of Population Health and Epidemiology at the Fairfax County Health Department, will provide specifics about the case.
Good afternoon. I'm Dr. Benjamin Schwartz. I'm the Director of Epidemiology and Population Health at Fairfax County Health Department. The individual from Fairfax City who became ill is a traveler in their 80s who had traveled on a Nile River cruise, similar to other positive COVID-19 patients that have been identified elsewhere in the United States. The patient developed symptoms of respiratory illness on February 28th and was hospitalized on March 5th with symptoms of fever, cough, fatigue, and shortness of breath. After test results for common respiratory pathogens like influenza were negative, specimens were collected and sent to the Virginia State Laboratory for testing. And the testing came back as a presumptive positive for the virus that causes COVID-19 on March 6th. The individual remains hospitalized and is in stable condition. As Dr. Adewayensu stated, the Health Department is working with the Virginia Department of Health and Fairfax City to identify any close contacts of this resident who might have been exposed. If other people are found to have been exposed, we will provide guidance to those individuals and will monitor them closely for the development of symptoms. We are working diligently and taking all measures to protect the health and safety of our residents. Out of respect for the privacy of the patient and their household, this is the only information we will be able to share about the case. I would like the public to know that no additional precautions are recommended at this time beyond the simple daily measures that everyone should always take to prevent the spread of influenza and other respiratory illnesses, to stop the spread of germs. These precautions include washing your hands thoroughly with soap and water for 20 seconds, covering coughs and sneezes, staying away from others who are sick, and if you yourself are sick, staying home and away from other people until you are well. This is a rapidly evolving situation, and information is being shared as it is known on the CDC, Virginia Department of Health, and Fairfax County Health Department websites. Thank you.